Hi, welcome to the next in Franklin Vet's spring series on assisted calving. I'm Taz Arby and I'm one of the vets working out of the Tokofita Clinic. This presentation is by no means exhaustive and it should only be used as a guideline on how to approach a cow that is in distress during calving. Calvings can be tricky and one can soon find themselves in a difficult situation. Before you jump in to assisting a cow, it's good to know what is normal. This will give you an idea of when to intervene and if things are wrong, how to get them back to normal. You need the right equipment for the job. It makes your life a lot easier and it's also safer for all those involved. You need some time and patience. You can get into a lot of trouble if you are trying to rush things and start getting frustrated and making bad decisions. You need a good sense of humor. These situations often happen very early morning or late at night and you end up very mucky afterwards. And you also need a bit of imagination to try and figure out what the calf is doing with its legs and also how to get those legs back to where they need to. What you need to know about the normal birth process is that it's divided into three main stages. The first stage is where the body gets ready and the cervix opens. Your cow might appear restless or a bit colicky, which is where it's showing signs of like gut distress. This normally lasts between 2 and 6 hours. It can be a bit longer in heifers. The second stage of labor is where the cow actually starts to push. You may or may not see a fluid bag being passed. The calf is delivered during this stage and it can last for up to 2 hours. The third stage of the birth process is where the afterbirth is passed. It lasts up to 8 hours. If the afterbirth has not been passed after 8 hours, you may be dealing with retained fetal membranes and this needs to be addressed. Sometimes it can be difficult to decide when to step in. If your cow's been actively pushing for 2 hours with no progress, or if she's been looking very uncomfortable for 6 hours with nothing happening, it's good to examine her. If you see an abnormal presentation of the calf, this might be where you just see a head sticking out or a cheeky foot. Maybe you can see a bum or tail sticking out. If your cow or calf are very valuable, best examine her sooner rather than later. If your cow is looking sick or exhausted, she will not be able to push that calf out. She does not have the energy. If there's a really bad smell, you might be dealing with a rotten calf. Get her in, have a look at her, and probably call your vet. If you are in any doubt, rather get your cow in and examine her and make a decision from there. If you're still not sure, then rather get. Calving is a lot easier if you have the right equipment. Keep it all together in a bucket. Makes it easier to grab when you need it to take to the cow. You can have quite extensive calving kits, but this is what we have for a minimum calving kit. You need to have some gloves. You want to be protecting yourself from any diseases you pick up from the cow. And you also want to protect the cow from anything you might introduce into her. We like to have an extra calving rope or calving chain. This is just very useful if something breaks or something goes wrong. And then most important is lube. You cannot have too much lube for calving. If you do not have any lube, do not try and calve that cow. Rather get the vet out or get the right equipment. Having a calving jack or pulley is quite useful, especially if you're doing a lot. It does just save you your arms a bit. And it's also good to have a bit of a first aid with your calving kit. You want to be able to give your cow metabolics as needed or oral drench, and then also the pain relief that she needs. Remember, you want to work smarter, not harder. If she's up, get her into the yards. Much better and safer restraint for everyone. You've got access to amenities, and if you do end up needing to call a vet out, it's easier for us to find rather than driving through your paddocks. If she's down in the paddock, try and figure out why she is down. you can refer to Jordan's presentation done earlier in the series on down cows. If she is down, try and get her up with hip lifters. This will give you a lot more room to work and manipulate the calf. If she is going to be up for a while, try and use a brisket strap as well. And then just remember, not all hip lifters will be adequate for assisting with the calving. Once you are all ready, make sure that you clean up your cow. You need to make sure as much of the poop and mud are off her. You don't want to be introducing any nasty bugs into her uterus that can cause a metritis or even potentially cause an infection in the calf. Once you're gloved and lubed up, you're going to pass your hand through the lips of the vulva and you're going to feel along the vaginal walls and try and establish if the cervix is open or closed. In this picture you can see that the cervix is closed. You won't be able to pass your hand all the way through into the uterus. With a open cervix, you'll be able to easily pass your hand into the uterus and it'll be quite a cavernous feel. Sometimes the calf is in the way as well, which means that you won't be able to pass it all the way in, but if the calf is in the pelvis, you know that the cervix is open. You can get a twisted uterus. In these cases, there will be a twist in the vaginal walls. An experienced farmer might be able to feel this. If the cervix is only partially open or if there is a twist in the uterus, you will not be able to calve down the cow and you need to get the vet out as soon as you can. Once you have established that the cervix is open, you need to establish if the calf is alive or dead. You can do this by seeing if it's moving. You can also pinch it between the toes and it should pull its leg back. Stick a finger in its mouth and it might suckle. Or if it's coming at you bum first, you can stick a finger in its bum and it should move away quite quickly. You need to establish which way it's coming out, which is quite self-explanatory. Is there more than one? You might be having twins. If you're sort of feeling 3 legs, or if you're feeling a back leg and a front leg at the same time, it's probably twins. And you also need to see how big it is and if it will actually fit through the pelvis. These show the normal presentation of a calf for being able to be delivered without any major issues. Remember that when you are pulling a calf out, that it's not a straight back, it's sort of an arched position that they come out over the. You need to establish if you are dealing with a weird position. Often they come out head first. But there are lots of varieties of positioning of a calf. A front leg or a back leg can sometimes be a bit tricky to tell. The best way is to have a feel as to whether there are 1 or 2 joints before you get to the pointy bit. You can practice this on a calf in the calf shed or even your pets at home by putting your hands on the joints and the leg and just bending it up and down and having a feel and get used to the feel of it. Once you've established what way your calf is lying, you need to figure out if you are able to correct the position into a position that the calf can be delivered. Just a note, if you are moving things around in the uterus, make sure that any sharp bits are cushioned with your hand. So when you are moving a hoof, try and cup it in your hand. If you're moving a head, try and block off the teeth from scraping along the. When using calving aids, it's very important that you know how to use them, otherwise you can end up in trouble, causing broken legs or jaws. With calving chains and ropes on legs, make sure that you use a double tie with the first throw thrown above the fetlock joint and the bottom throw below the fetlock joint. You can practice this using ropes or even your own calving chains. You can use a bottle or a fence post or something like that just to practice making the ties correctly. And then if you are using head ropes, remember not to put it just in the jaw. You can break a jaw by holding it on the bottom jaw. please put it through the mouth and over the ears. Also, never put it just around the neck, as you can strangle the calf. When using traction, remember that there is some very strong legislation about using traction. You may not use a motorized moving vehicle. You want the force of 2 average strength people. Remember that this is not a strongman competition. You can use calving jacks and pulleys. In fact, we recommend it. It makes it a lot easier. If you're doing paddock calving, you can use a stationary vehicle as an anchor point. And then always at least have 2 anchor points on the calf. 2 legs are preferable rather than just a head and 1 leg. This is to prevent any damage being done to the calf. Make sure that you know how all your equipment is used and how to rethread pulleys if you need to rethread them. And then just a sneaky trick, if you do have a really big calf that's getting stuck sort of over the shoulders, you can walk it out by pulling 1 leg slightly forward and then the other leg slightly forward, so you're sort of walking it out through the pelvis. Then our golden rules of 10. If at any point you aren't progressing after 10 minutes, try something else. If you're unable to correct the position after 20 minutes, rather call the vet. You don't want to be exhausted yourself, you don't want to exhaust the cow. Those all end to more poorly outcomes. If the calf is in a normal position to deliver, but you haven't been making any progress with 10 minutes of traction, please call your vet. You may have an abnormal calf, such as a water belly or an inside-out calf. So very well done. You've managed to a successful calving and getting the calf out. You've essentially decalfinated it, as we like to joke. Unfortunately, the job does not end there. Once the calf is out, you need to check that it is breathing and the airways are clear if it's a live calf. Check joints and legs for any breaks, especially if it was a hard pull. If the calf was stuck in the pelvis or the head was stuck and is a bit swollen, it might be a bit oxygen starved and you need to treat that accordingly. Once you are happy that the calf is okay, you can process it into the calf shed as normal. You can refer to Henry's calf management presentation done earlier in the series. You need to check the cow over as well. Put a hand in, make sure that there isn't a second calf hiding in there. The other thing that you need to check for is any severe bruising, any tears or rips of the uterus or vagina. Serious tears do need to be seen to by a veterinarian. Please use pain relief as needed. These cows have gone through quite a trauma, and it will be much better for them in the long run, especially with their production targets. If she's looking a bit sickly, you can also give her some oral drench or metabolic bag. And then don't forget to give her the oxytocin after the calving. It does help with getting the uterus back to its normal size. Also, you need to check your equipment over and give it a good clean. You don't want to be using dirty equipment for the next cow. This is a good time to restock as needed and also check for wear and tear. There is nothing worse than having a rope snapping while you're busy with the calf thing. So in summary, make sure that you take your time. Rushing leads to bad situations. Try and figure out why she can't calve by herself. Be confident of what you can feel and that you can correct it with malpositioned calves. Make sure you work as clean as possible. Use pain relief. Your cows will thank you in the long run. You can also use some pain relief on yourself. Your back will thank you in the long run. Be mindful that cows that have had difficult calvings are more prone to secondary diseases such as milk fever or metritis, or even retained fetal membranes. And then if you are having a lot of assisted calvings on your farm, it might be worthwhile getting your vet to investigate and get down to the bottom of that problem. So thank you for listening to our presentation on difficult calvings. Please remember that if you do ever come across a very difficult calving, don't panic. If you have any questions, please feel free to comment below.